All right, we are live. Mike Donio, welcome to the Terrain Theory podcast.
Hi, thank you for having me.
It's great to have you here. Can you give us a little bit of a background, who you are, how you got here?
Yeah, sure, absolutely. So, I am a scientist with 20 years of experience doing research in the lab. And so what the heck does that mean, right? Because anybody can say that they're a scientist. So, I have experience in virology, in cell biology, biochemistry, molecular biology, electrophysiology, immunology, oncology, probably more that I'm not thinking of. I was fortunate throughout my career to have been exposed to a lot of different scientific disciplines, and that was rare in the former industry that I was in, where most scientists are highly specialized. And so it's something that I think gives me a unique perspective, and it's also something that I think should be more the norm. I think it's not good when you have scientists that are so overly specialized. So I like to point that out. My undergraduate degree is in biochemistry and molecular biology from the University of Massachusetts, and my graduate degree is in biotechnology from Johns Hopkins. How did I get where I am today? So my last role was I was a senior scientist at a biotechnology company in the immuno-oncology space. And so what that is developing antibodies to treat cancer. It's trying to kind of activate the immune system to target cancer cells. And so uh, I think it was end of August, early September of 2021. My company, small biotech company, um, kind of did what pretty much the entire industry was doing at that time and rolled out a COVID vaccine mandate. And I filed a religious exemption, and they obviously did not want anything to do with that. And uh, I was pretty quickly let go. And since then, I've been speaking out, talking about the state of science and COVID and lots of different things. And I just really appreciate any and every opportunity to kind of speak about this stuff and share the truth. I think we need more. There's not enough scientists out there that are willing to step forward, and I certainly understand why. But if I can do my part, I'm happy to.
And so let's talk about that. We haven't had a person with your scientific background on the podcast yet. So I'm very curious to know, in your opinion, what is the state of science in the world today?
um, from everything I've seen throughout my career, up until certainly the last, I guess it's almost 3 years now. Wow. With the COVID situation, the state of science is not good. It's we're in a situation where what I think has happened is science has become scientism. It's been elevated as effectively the only allowable source of knowledge of basically our reality of anything and everything, of health, of and so in doing that, then we must in turn trust the science. We must appeal to it for everything. And that, of course, has led to a situation where it's been utilized to impose a lot of really terrible draconian measures like vaccine mandates and other things over the course of these past few years that were previously unthinkable. And largely that stems because, again, you have this situation where people are just trusting the science. They're believing in the science without really understanding, number one, what does that mean? And number two, can science really answer all of these questions that we're expecting it to? I would suggest that it can't, although at one point I believe that it could. Um, and then you have a lot of issues with science, where it turns out the data. So a lot of people just think that they can go and look at scientific papers and things like that, and they can just believe the data that's coming out. Somebody says, "Oh, I've published this new novel finding about whatever." a virus or something, and that you can just trust that. Well, it turns out the majority of papers can't be reproduced, and it's more than likely that the majority of findings in these papers are false. So you really have this systemic issue that is where the great preponderance of the data that's coming out is highly questionable at best, but yet all of the scientists think there's nothing wrong. It's not that this is not known within science, within industry, within academia, but they just go along and think, okay, this doesn't mean that anything, that the data or the findings are invalid, or that there's flaws within the system, you know, so nothing changes. And then we go through a situation like COVID, and we see kind of the fruits of that, where you can push whatever information you want to drive a narrative and force people to do crazy things.
One of the things that we try to get to on this podcast, and we feel that folks who are practicing true medicine also try to do, is get to the root cause of an issue. So as we explore the root cause of where science is today, like, how do you feel we ended up at this point?
Well, I mean, I think science is it definitely is something that has evolved quite a bit over the last 150 years, and just like medicine has. And it's it's definitely something that has a lot of good uses, but the problem is when you try to utilize it to explain everything, it's going to fall short. And um we I mean, it it's the problem is we're not recognizing its limitations and understanding um where and when it should be used, how to use it properly, how to properly apply the scientific method, things like that. And that's really at the kind of the root of true science. It's getting to an understanding of what science really is, what it should be, the study of naturally observable phenomenon, studying, experimenting to understand their causes. Most of the time in science now, especially in what is called like pharmaceutical science or medical science, biomedical science, it's looking at effects, because you're studying the effects of drugs or things. You're not really doing true science. We've totally drifted away, because, and I think this gets down to when science became a business, when it became for profit, you lost true science, because nobody cared anymore about truly doing it the right way, understanding things right. It was all about how do we get to develop new drugs and get, and so we've just drifted further and further away from what is true science, and knowing how and when it's supposed to be used, and leaving it at that, and not trying to plug it in for everything.
When you started to look at the science, in quotes, of virology, as a scientist who understands the scientific method, what were the most glaring issues right off the bat for you?
Yeah. So, I mean, from my own personal experience, I one of my first jobs following my undergrad degree was studying HIV, and I went into that as a young, naive scientist that had certain preconceived notions from my schooling of the way that this should work. And then I was quite shocked when I saw actually how it did work, and what they actually did in these labs. And so I started to immediately dig in, and ask questions and do my own research, and came across lots of people that were questioning virology. But just as I things like, I would have thought, if you're studying a virus, you would be studying an isolated virus from a patient sample. You want the most direct thing you can from somebody that's sick. If you want to know what's causing them, you're trying to understand that, and then in turn design or develop, kind of therapeutic interventions or whatever. Um, that's the way you would do it. But it turns out that's not the case because you can't get enough from patient samples, which, of course, then that begs the question of how does it make you sick? But um, so then you wind up using all of these crazy artificial systems, these cell culture based systems to generate basically virus stocks, which are really synthetic. They're, you know, basically like pseudoviruses. They're not really mimicking anything that may or may not be real in nature. Right now, you're totally into a whole different realm that you can't exactly you really can't at all compare back to nature, but yet that's what's used to study and to draw conclusions and to say this is what we know that viruses are. Or then, of course, as we've heard, we do these crazy isolation experiments, again, using these cell cultures and these artificial models, and then claim that we've isolated a virus, or we know that a virus is there because we've used some indirect assay to measure some activity, or used an antibody to detect what is believed to be a viral associated protein, and then that's how we know there's a virus there. But there's so many flaws with that, um, that for me, I mean, I just saw red flag after red flag, and it only got strengthened, I guess I would say, as I went throughout my career and got into other scientific disciplines, and saw that this is not even just virology, and this is something that's uh, pervasive throughout scientific research. um, but it really it also at the same time kind of solidified my beliefs about virology being problematic. Just that
So you
it's more than that.
so you were having these suspicions and these doubts before even the pandemic, before coronavirus and
Mhm.
COVID-19. Would you ask questions? Were there others that had the similar doubts?
Yeah, so when I was doing HIV research, I also did some work on some hepatitis, HCV, and I think maybe HBV, but HCV later on when I was in pharma. But so when I was doing HIV research, it was a really small lab, and it was a lab of a pretty highly um, touted like infectious disease doctor that had studied actually at NIH under Fauci, oddly enough. Um, and so it was kind of interesting. I mean, here I am, young scientist. I'm doing research myself, trying to figure out what in the heck this actually is that I'm doing. And I come across all these people that are questioning the HIV/AIDS paradigm, the Peter Duesbergs, the David Crows, the Rethinking AIDS. I actually signed on to the Rethinking AIDS thing, and then came across the Perth group, and I remember, I think at one point I did actually ask the PI, this infectious disease doctor, um, some questions about it, and he was pretty strong in his beliefs, but I was surprised that he didn't really have a huge issue with me researching myself and trying to understand more about what different sides of these arguments and what. And he then even expressed to me some concerns he had about how the data, the demographic data, was being represented, because it was being spun to suggest that the whole thing was that they were trying to drive this narrative that HIV was going to explode in the heterosexual population and just become this massive pandemic everywhere. And of course, that was not the case at all. But it was just how they were manipulating the demographic data to make it look like it wasn't occurring in pretty much largely a single discrete population when it really was. And so he would talk about stuff like that, but I don't think he really wanted to poke too much into the paradigm of whether or not the virus, because with HIV, the people questioning it, some were saying it's just a harmless passenger virus. It's not causing AIDS, all the way to some that were saying, like the Perth group, that we don't even know, we don't even think it's been isolated. Does it even exist? Um, like, but I that was kind of interesting. I was surprised that he didn't just entirely shut me down right off the bat.
But you weren't there were no other, like, coworkers that you could turn to and sort of nudge with your elbow and go like, "Does this make sense to you?"
I did have there were 2 or 3 or so other of us, and I probably bounced questions and stuff off of them, and but, they weren't questioning it as much as I am. I found it's not I don't wanna come across that no scientists question anything, or that, this idea that, like, they're all in on it, or they're all just blind to these things. I've definitely worked with scientists that have had similar questions, have questioned things similar to the way I have, but most don't go to the level that I have, I guess would be the best way to say it.
Well, you've gone to that level almost out of necessity, haven't you?
Yeah.
You've stepped away or lost your job, and now you see the dangers of continuing down this path, science continuing down the path it's continued, because we will lead to more situations like you found yourself in and others may find themselves in.
Yeah, absolutely. I mean, somebody recently asked me, would you ever do you think you'll ever find yourself back in that industry, or in scientific research or whatever else? And I just said, quite frankly, I don't see it. I don't Just the way that the state of scientific research is now, the system, the way, I mean, what I know that it is, and that I don't see pharmaceutical medicines as a viable path forward to achieve health. Um, Not to mention the fact that I pretty much, when I didn't comply and was fired, nobody wants to hire. They're still in that industry pushing the vaccines and mandating it in a lot of places for hiring. So, I mean, that would X me out of most of it anyway, even if I did want to go back. But I really have no intention, at this point, of doing that, just because of what I learned throughout my career, and now what I'm, as I've had this last year and a half almost, kind of to reflect on that and learn even more. Uh, yeah, I mean, I just don't see that as being what I initially thought was a situation where I could do some good through, helping to develop new drugs and stuff like that. I don't see that as the right path anymore.
When someone who is as steeped in the industry and the background and the knowledge as you are comes up against this, this reality that things aren't perhaps what I've been taught or the way that they have been shown to me or told to me that they are. Folks, we see it now, like cognitive dissonance is real, and often folks will just shut down and not continue forward. I mean, did you have that point? Did you have like a, okay, things are just melted and now I'm in this new world where virology is not what I was told it was, and even all the, the foundation of your education and your background as a professional is up in the air and in question. I mean, where do you stand there as far as like the cognitive dissonance goes?
Well, I guess I kind of largely blew that right out of the door. Like I said, when I was a young scientist with studying HIV, and I started to realize that even that was, based on a lot of faulty assumptions and stuff, and that kind of drove me throughout my the rest of my career in pharma and biotech to just continue to probe and ask questions. And never really, accept everything that was being told to me. But at the same time, I guess I did fall somewhat into this idea that, even though I knew that there were a lot of problems with science, I knew that, um, there were things that were wrong on different levels, but maybe it could still be fixed, and maybe science was still, the main, or the best answer to a lot of problems or whatever. But, once I went through this situation with COVID and the vaccine, that really kind of just eviscerated any remaining thoughts about that, because it kind of showed me once and for all their true colors. Like, they you know they only care about basically making money, which, as you realize what these industries are. But and if they're going to force people out, and good scientists who have dedicated their whole careers to doing this stuff, what do they really care? I mean, what is this really about? Um, and I start to realize that, you know, this isn't just about science having all the answers. It's valuable, but it's not everything. And so yeah, I think it's been quite a journey, definitely since COVID, but it's something that I've walked my entire career, and then but just didn't quite want to go all the way, I guess. But COVID kind of finished it off.
And how does that feel?
It's great. I mean, it's been really liberating to be on the outside now, to be able to speak about it, um, to not have to face, I guess, the pressure and the anxiety of being inside in that situation. I mean, the threat of retribution for speaking out and for pushing back too hard is real. I mean, I'm sure that I lost opportunities because I was a thorn in people's side. I would keep pushing and asking questions, and they knew that I was the guy that was gonna, if there were issues, I was gonna be vocal about it, and I would shoot down somebody's big chance or whatever. So um, it's great not having to worry about that stuff anymore, and to be able to talk about it. There's even more that I would love to be able to talk about actually than I have already talked about. But like I said, I'm involved in a legal challenge against my former employer. Once I'm through that, there's more in terms of um, what I would call like either negligent or fraudulent behaviors that I've observed that were really, really quite bad. That to really drive home. I've talked about problems with science and with drug development and things like that. I there's things that I'd really like to get off my chest that would really, really drive home some of these points, but I just unfortunately can't do that yet.
Yeah, understood. We look forward to that becoming a reality. Mike,
hmm
folks like Tom Cowan and Sam and Mark Bailey they're having come through the allopathic training as you had, essentially, the traditional education in medicine. They're now starting to question the very foundations of cell biology and how the immune system works, or our understanding of how, or how we thought it worked. Are you at that place as well, where you're really questioning the entire premise as it was taught to you?
Yeah, I mean, I keep a very open mind, and I'm willing to evaluate anything and everything, and I think it's absolutely worth revisiting these foundational premises.
Right.
I don't necessarily. I'm not of the stance of let's just tear it all down. Everything is fake. Let's just burn the place down and start from scratch. I mean, um, I don't I don't know that 100% of what we've learned, what we've been told, is totally wrong, and I think it's a sizable challenge to sort through that and to understand and to really critically evaluate these premises and these foundations and say, what can we believe or trust, and what is really just on quicksand, what is really faulty, because a lot of it is just kind of built up on a house of cards of unchecked assumptions.
Yeah. Well, on that subject, one thing that just occurred to me, because words are so important, is, and you hear trotted out in this community, viruses don't exist is one way of saying it, right? Should we just stop using that word?
The word viruses.
Yeah.
Yeah. Well, right. I mean, that's a great question. Like, why do we? Yeah, because words are so powerful, and we don't
Yeah.
realize that. And clearly, the way that that word has been used for so long, and how it's been basically entrenched in people's beliefs systems from when they're born, almost because they're told that viruses or germs are the cause of any time they get sick, you caught something. So it has this clear stigma, and you hear, oh, novel viruses, but
Yeah.
that evokes a clear response, probably on multiple levels. And um yeah, so I think it would be great if we could do away with that. In fact, I mean, when we look at the origins of the word, it really just virus was Latin for poison. And
Right.
that's really what we're getting at. I think with a lot of this is we're being poisoned by a lot of different types of toxins on different levels, and yet we want to boil it down to one tiny particle that may or may not exist and say that that's the cause of all the problems.
Yeah, well, a friend suggested maybe we should substitute toxicology in for
Hmm.
virology, is essentially what you're saying. And it's
Yeah.
interesting in light of the toxic event that just happened in Ohio and all the inevitable um, illness that will follow in its wake. The fact that it's not being discussed through the through the lens of what we're discussing, toxicology, it's one and the same. It's every insult to our well-being seems to be a toxic insult, and that can manifest through a physical substance, like a toxin, or of course, as we've explored, trauma as a toxin, or you fell off your horse, as Tom Cowan likes to say. Um, but it's just interesting because people say, well, viruses don't exist, but here's what a virus is. It's like, well, you can't have it both ways. So what are these particles? In what words would you suggest in their stead?
If such particles were
If
to
such
exist,
particles were to exist, are they? One phrase I've come up with is blaming the scab for the work of the knife. Are these just like scabs? These
well,
things that we're claiming as viruses?
right. So one of the things that I've identified that I think is an issue through not just virology, but potentially in oncology and other places too, is scientists have identified what are potentially the after effects of something occurring and then attributed them as the causes.
Yeah,
And it's like, so with cancer, the big paradigm is about mutations, these spontaneous mutations that drive oncogenesis, that drive the tumor formation that lead to the out of control growth. But you could also turn it around and say, well, assuming you believe mutate, what's any of that story, but that the mutations are derived from as a result or response to whatever's causing the tumor. They're not actually causing the tumor,
yeah.
and I kind of like something more along that. Although I mean, I'm my thoughts on cancer are evolving too, um, I think you could potentially look at that in a similar fashion with these particles too, if they did in fact exist. That you know we still, even if you were to come up with a strategy to isolate these particles, you could get a good pure isolation and study them. That doesn't mean that they're causing disease, right? So I mean, we're multiple steps away. Just we're saying there's not evidence that these things have been identified, that they've been isolated, that they exist in nature. But even if you were able to identify them, there's another whole step of trying to prove that they actually cause disease, that they do anything that's been attributed to them. And like, I mean, let's say you did identify them. Yeah, maybe they're an after effect, or maybe they're doing something else, or they just happen to be there when somebody, who knows? But yeah, to just we in science, they want to find, obviously there's a necessity to find something that's a cause that can be targeted, right? Because it's all about developing a drug or a vaccine or something. So whether or not it's true, if you can find a cause that makes sense, that's druggable, that's suitable for most scientists to say, okay, we're good, now we can move forward with this.
Another principle that really resonated with me, something that I picked up from Tom Cowan, is just this idea. It seems very obvious, but I think a lot of people, layman people like myself, people who aren't scientists or medical people, the idea that as soon as you remove a piece of biology, for lack of a better term, from the body, that's a major thing. I mean, that's the major thing. And as we
Mhm.
take for granted, well, like they're in a lab, it's in a petri dish, it's they're studying it. What is it that's even in that petri dish once you remove it from the living system is no small thing.
Absolutely. This is a point that I've been trying to bring up, and it's something that is actually debated within labs. I mean, talked and kind of debated a number of my former colleagues about this kind of question in the context of cancer, but it's valid for really any kind of science where you're trying to study something that's, whether you're evaluating something that supposedly is causing a phenomenon in a human being, or you're studying it in an animal model. Once you take out a sample, a tissue, whatever from that animal, you've changed it. It's not the same thing that it was when it was in that living organism. And when you do animal studies in, say, oncology, you usually use mice. And when you want to take a sample out, I mean, you can take blood or certain things while the animal's still alive, but a lot of times you want to look at tissue, you want to look at the tumor or other tissue to try to, if you see what you believe is in effect, you've managed to inhibit the growth of the tumor or whatever. You want to look at that and analyze it and try to come up with some story to explain why you're getting that, if why your drug is causing that effect. So, but in order to do that, you have to kill the animal, you have to put it down and then remove the tissue. Well, you kill the animal, that changes the system considerably, and then you take the tissue out. This is called ex. So we have in vivo, which means in life, ex vivo, which means out of life. You're taking it out of a living organism to study it, and then in vitro is anything that's like just in the tube, in the dish. That's the cell culture stuff. So, but anytime you take anything out of a living organism, or if you have to put that organ, if it's an animal model and you have to put the animal down and then remove tissue, you're considerably changing it. And you can't say that whatever you observe is exactly what was happening when that animal was alive, and whatever, in the sample was in the animal. And yet most scientists just, they don't know what to do with that. So they just say, okay, well, this is the best we can do. That's what
Right.
a lot of the answers when I probe with this kind of stuff, it's like, well, this is the best we can do. So this is what we do. I mean, but it's
But
ridiculous, right? Because if you acknowledge that you're changing these things considerably or potentially considerably, and that's not even accounting for whatever processes you're applying to the samples to do whatever the experiment you're doing, or to look for whatever you think is going on there, like with a sample that you're taking to do, say, electron microscopy, where you're preparing it such that you can make these thin slices, and then you have to fix it, a lot harsh chemicals that basically kill the tissue and arrest any metabolic activity, and then you stain it with heavy metal stains, right? And so those procedures then are going to have other impacts. You're further changing the tissue considerably, and that's the case throughout with any kind of experimentation, whether it's in vitro or in vivo. Anytime you're, or sorry, ex vivo, where you're manipulating samples and tissue, there's always lots of steps that impart a lot of stress, whether it's mechanical, whether it's when you're doing these centrifugations where you're spinning the samples at high speeds, that imparts physical stress on the sample that changes it, can break things down, can, or it's chemical stress if you're treating these samples with harsh chemicals like they do to stain these things for different kinds of microscopy or imaging. It's just more and more impacts that drive it further away from what you believe is going on in the organism, in nature. And it's hardly ever, if at all, accounted for the fact that what you might be seeing could be totally artifactual, or at least you could be causing artifacts that could be misguiding you, even if there's something in there that's real. I mean, nobody accounts for it. It's kind of
it's funny
mind-boggling.
that I just had this vision of, if you put me or you or Ben in one of those like amusement park rides that spins around and you stick to the wall, like, okay, as a kid you might survive that, but yeah, if you do that to me now, I would certainly walk out and I would probably vomit or fall on my face. And it's pretty analogous to if you do that to any tissue, there's going to be a cause and there's going to be an effect. So it's at some level it's that simple.
Yeah, absolutely. That's a great way of thinking of it, because that's pretty much like what you're doing with the centrifuge, although even faster. Imagine you're spinning even faster, and then
But the alternative, Mike, is to try to study this phenomena within a living human, which has its own problems and limitations.
Yeah, I mean, well, obviously, with in the case of the of viruses or supposed viral particles, I mean, they're submicroscopic, or if they, so like you wouldn't. There's no way right now to even visualize them without significant manipulations outside of a human. So there's certainly no way to visualize them inside of a human. There's nothing that you can utilize inside of a living human that could get you to that magnification. Um, but yeah, for anything else that you're trying to study, yeah, I mean that there's obvious significant moral issues, but it's not to say that there's not clinical trials where they try to do things and to collect data, and I don't think that that's right, but it does create a significant question because you're using models in the lab, animal models and in vivo systems, cell cultures and things to attempt to try and recreate what you believe is going on in a living human, but you can't possibly do that. I mean, it's just not the same, and I could go into lots of reasons why that is, but and quite frankly, what a lot of scientists are realizing is that these models aren't predicting in any way, shape, or form what is going to happen if you're developing a drug and you're testing it in these models. You're attempting to try to replicate what's happening in the human and predict what's going to happen when you go into a clinical trial. Well, turns out they're not predictive at all. I mean, in many cases, you have this data that you generate, this preclinical data that enables you to file all the regulatory stuff to get into trials, and you can make it look like you have all of this activity, like your drug is doing amazing things in a mouse model, it's shrinking tumors left and right. You go into the clinic and the drug does nothing. And I've seen that so much. And now scientists are finally going, okay, well, yeah, these things they're not telling us anything. So then why are you doing it? Why do we keep using these terrible models but so again, this is another situation where science is kind of like, well, this is best we can do, and it's what's required to get us into the clinical trials. And again, so when science becomes a business and about profits, biotechnology is profiting off of innovation. So it's all about, how do we move this along and build value and generate profits? Well, we don't worry about, like, are we actually doing this in the most ideal way or actually replicating something that truly exists? And that's where you get into some questionable territory.
Mike, I respect that you said you're not ready to burn the whole thing down, meaning like the foundations of scientific knowledge. But it sounds to me like science itself right now is irreparably broken. If it's not, like, what does it take to fix it? It sounds
I
like removing money.
Mhm.
Simple as, is that it? Simple as that?
Well, yeah. I mean, the funding, yeah, is what is driving, and of course the profit aspect is what is driving it down this path of destruction, effectively. Um, because you can't do anything, you can't question anything, you can't interrogate, do real science, largely because you can't get funding for it in many ways, in many cases, or resources. If I want to go and write a grant to say I want to look into, you know, whether viruses exist or do, a study on proper isolation of viruses, whatever, it's never going to get funded. I mean, so that's why this stuff just hasn't happened. And there's a lot of good people out there that believe, and I was one of them, that you could fix the system from the inside, but I just don't see how that's possible anymore. I think, like you said, it's irreparably broken. And but then the question becomes, do we tear the whole thing down and start from scratch? Or the other option is perhaps build something new in parallel
Right.
that, is what, a preponderance of people who are questioning this believe, that is more in line with true science and respecting what it can and can't do and trying to really stick to the core of real true science. And I mean, it would be awesome if something like that was was possible, but that kind of remains to be seen.
Well, it seems like at a grassroots level, if I mean, just having these conversations of questioning the paradigm and knowing that another paradigm is possible is certainly steps on this new path. I would argue. But is the funding there? Is it being built up as a competitive industry yet? Um, Maybe certainly not at the level of the behemoth which the current paradigm exists at. But I feel like it is happening because of people like you having the bravery. I think is probably the most important variable. Like having the courage to step out, to blow a whistle, and to speak your truth, creates a new reality in its wake.
Yeah, I mean, it certainly leaves me optimistic, although I mean, it's not a small task to go up against the current paradigm and attempt to create a new system, whether it's funding, resources, I mean, or simply getting the information out. We need a new system of peer review and publishing data and information that's entirely different as well, because I've seen where some people have been able to raise money or do certain experiments in different ways, but then they struggle with getting the information out. And then if it's not published or peer reviewed or whatever, then people are like, well, I don't really care. Right. So I think you can't go part of the way. I think you got to go the whole way or none of the way, because you've got to be able to make it so it's convincing to people who are entirely sold and embedded in this old paradigm that this is a valid way forward.
I had this idea. I don't even know if it exists or if anyone else has thought of this or tried this, but like, Mike and I had these conversations, just months ago about the funding, how most of the funding comes from private industry, pharmaceutical industry. So we're never going to get like good studies on vitamin D because, where's the money in that? A citizen, like a citizenscientist.org, like a nonprofit. We've got folks who will donate their money to like GoFundMe's for people they know in their family who are sick. Like, what could we get a grassroots system, citizenscience.org, where people can donate their money to this organization, and the organization is run by like a board of trusted folks like yourself or the Zach Bushes who determine what science we're going to pursue. These are the methods, and they're just fully transparent about how they're going to pursue it and then what studies you're funding by donating to this organization. If there's enough folks out there who are aware of the brokenness of the current system, they might be willing to go, you know what, I actually have these questions myself, and this is an organization that's willing to ask those questions, and they seem to be using the proper methodology, and they're transparent about everything they do. Like, I just sometimes I go, that has to be possible. People will donate to a GoFundMe. Why won't they donate to something like this? Like, let's fix the system from a grassroots
Mhm.
approach.
Yeah, I think that would be great. I mean,
I'm pitching you right now, Mike Donio. I want you to be the president of the board of this organization. No, I don't know. It's like a pipe dream, but I'm like, it has to. I think all the change has to be grassroots at this point. I don't see it being
Mhm.
top down at any point now moving forward. I don't see top down change happening. I feel like it's got to be bottom up.
Yeah, yeah, I wholeheartedly agree, and I think that's an awesome idea. And I mean, at this point, like it has to just start somewhere with something like that. And it's not. I would never even think about like going toe to toe with the behemoths of industry or anything like that, because quite frankly, who cares? I mean, you'd be doing something different that would hopefully be based on true sound science, and um, it may not have value for everybody, but I, I could see it having a large enough appeal and value for a solid enough group of people that it would be worthwhile, and like you said, could probably be achievable. But there's obviously a lot that would need to go into it.
A lot that would
Yeah.
need to go into it. Let's switch gears real quick, Mike. You mentioned in your videos numerous times applying your God-given gifts to what you're doing now. You also mentioned filing religious exemption. Curious to know what role faith plays in your life.
Yeah, so I've always been what I would consider to be a Christian, but kind of never, it was more of kind of just through my upbringing, going to church with my parents, things like that, not really forming a concrete set of beliefs myself, or really, picking a particular direction. Um, and I kind of came shortly before COVID. So the end of 2018, um, I lost my dad to pancreatic cancer very quickly, and kind of wound up at a crossroads where I was like, okay, either I'm, because I was frustrated and angry, and it was like, I could have gone one way and said, there's no God, I'm walking away from this. I don't, but for whatever reason, I went the other way and pushed in more. And from then, my faith has grown and strengthened. And that played a significant role in when the vaccine mandates and the vaccines came out. And I mean, obviously, there was a huge element of my, as a scientist with all my experience doing research and actually trying to understand what, that played into my decision too. But my faith was a huge element of that, because, and from going through what I did with my dad and kind of having that tested there, knowing that that was something that I could stand on, that I could have faith in making a decision, a leap like that, and not having to fear what was on the other side. Because I think so many people are just frozen with fear, not, either by the threat of the virus, or by, what do I do if I'm not going to do who and what I am now? And my faith and my beliefs allowed me to say, okay, I don't have, not only do I not have to fear the virus or the fact, this stuff, but I can get through and get to the other side of this. And I know it'll be okay. I know it'll work out. And I've managed to connect with so many incredible people along the way that I just can't, I mean, it's just happened in an amazing way. It's been an incredible journey. I don't know, but my faith has remained strong, and I lean hard into that, and I don't push my beliefs on anybody else, but I'm happy to talk about it because it's something that is powerful for me.
I appreciate that a lot, Mike, and I appreciate you sharing that. I think that's these conversations. We're told don't talk politics and religion at the dinner table, and I feel like that's part of maybe why we're in this mess, is because we don't have those conversations that around some of the most important topics in our life. When you were talking about science, you mentioned that you came to a realization, or you're at a place now where you feel like science can't answer everything, science can't solve anything, and I wonder, does then faith sort of fill that gap?
Yeah, so I think it then comes down to things like faith, theology, or uh oh man, um why am I drawing a blank? Philosophy. I couldn't
Mm.
think. um Things like that are other sources of knowledge. And in fact, really a lot of discussions that we wind up having around science and whether we believe this or that, or this is, when it comes down to trusting the science and all this stuff, wind up being philosophical or having a philosophical basis anyway. Yet, we keep being told to appeal to the science. But what we're doing is scientism, which is, like I've explained. And so, yeah, when what we the thing is realizing that there are other sources of knowledge, theology, and philosophy, considerable, and in many ways more so than science. And science is formed, a lot of scientific theory beliefs are formed by philosophical underpinnings. And so, really looking at, well, what is science, and what are its limitations, it kind of shows that it really can't, we expect it to answer so much more than it really can. And then at the same time, we've taken these other things, and they've been marginalized and said, well, they can't give you anything that's fact, only science can. We can't know anything for sure. Something like, um, religious belief, theology is just your own personal beliefs. You can't know that. Only science, only that is the only thing you can know for sure. Except for you can't. There's no absolute truth in science. But so I think understanding that there's more tools, knowledge for us to utilize to understand the nature of our reality is critical, and to stop just this over reliance on science.
You mentioned that you felt like religion is something that's being marginalized, and I wonder if you could get into that a little bit more. Like, what are the ways that you see religion being marginalized or perhaps under attack? Certainly, the rejection of the filing of your religious exemption is one obvious example, but are there others that you see? And what do you feel is the state of religion and faith in our world, in our society?
Yeah. Well, so that's become a whole beast unto itself, because especially in the West, organized religion is basically like any other company. It functions as, these are 501(c)(3) organizations that are connected into the government. I mean, and so you saw what happened when COVID came. They rolled over on all of when things were locked down, they shut their doors. When the vaccines rolled out, they held vaccine clinics and stuff like that. And you're like, how does that, this is supposed to be, a church and religious institution, and you should have certain belief systems and things. And then when people come and say, I want to file a religious exemption, and then the companies appeal to that and say, oh, well, the church is all closed down, all the heads of all the churches are saying this is fine to take, they're all holding vaccine clinics, why should we care about your religious exemption? Well, right, so the whole entire system, in terms of the religious system, has been totally changed and stacked against people. And I mean, I look at it kind of in a similar way that I look um at pharma. Like, organized church is no better than organized medicine in a way. Like, it's largely, organized medicine has become the same as organized church, I guess you could. And to me, my Christian beliefs. It's so much more than just organized religion, as a content. There's so many problems. I hear people that get frustrated when you talk about being religious, because there are a lot of problems and connotations with organized religion and institutional religion. And unfortunately, what that does is it causes people to walk away from any beliefs, and instead of realizing that all that stuff is just a facade, it's just something that's created by men, again, to create systems and structures to kind of impose their will on you, and that's really not what's at the core of these beliefs. And I think we've seen that shining through with COVID, where they've utilized these religious institutions to as part of the the hurting of people, into these horrific measures.
The coercion measures, yeah.
Yeah.
We I think we're mistaking the person's affiliation for an organization rather than the personal relationship you have with God, which is really the thing that is, should be sanctified and protected. That's all that really matters. It's not what church necessarily I attend or who is the
Hmm.
head of that church or organization. It's my personal relationship with the creator or what I call God.
Right. Yeah. Exactly.
Yeah. Mike, as we're coming up on an hour here, wanted to ask you a question that we ask all our guests. What are your non-negotiables, those daily habits that you do to tend to your terrain?
Well, for me, this has been an evolving process as I've continued to learn more, especially since walking away from the industry that I was in, and getting trying to free myself entirely from, and I pretty much, and I am, and my family too, um we're entirely sworn off of any kind of pharmaceutical interventions whatsoever. But I've really tried to embrace a much more natural situation in terms of diet and nutrition and exercise. So I'm very critical of what I put in my body, and making sure that where it's coming from, and that it's not, well, minimally processed, I've found a great farm that's in the state that I live that does regenerative farming. They have all grass fed, finished, pasture raised animals and raw milk and all that sort of great stuff. And my kids love it. And so that's become a huge part of our kind of routine is bringing really good, wholesome, natural food back into the house to try to restore our health in that way. And I'm just, I continue to learn more and more about different ways to build and support the terrain. And so I think it's just for me, it's going to continue to evolve, and I'm going to continue as a scientist testing different things out between myself and my family and see where things go.
And then, Mike, what's the best way for the audience member to learn more about you and follow your work?
Yeah, so I have a Substack that is where I'm putting out a lot of my content these days. It's called Still in the Storm. So stillinthestorm.substack.com. I'm also on pretty much any social media these days. If you look at under my name, Mike Donio, on Twitter, I'm at Mike Donio. Um, I am like I said, I'm putting out a lot of, or I'm trying to put out a lot of content on that Still in the Storm science related, but that was kind of, again, as the title says, to help people find find their peace in amidst this crazy storm that's been raging all around us these last 3 years. Um, and so that's kind of my personal thing. Then I'm also working on a project because I look at this as there's two sides to this coin. There's one is about going out and telling the truth and illuminating the public to what is truly going on behind the closed doors of the labs and the boardrooms and in science today. But once you do that, then we need solutions so that we can try to make sure that this doesn't happen again. Because I'm looking to the future, to some extent, or maybe all of it. I don't really care what happens to me. I want to try to pave a better path for my kids and so on and so forth. And so I'm looking at solutions. And so what I've come up with is called Science Defined, and it's basically a way to try to make science more approachable to anyone, regardless of your background. And it really centers on the idea that the biggest obstacle to accessing science is the terminology, because it's a whole separate language, much like legalese, law, or um, other things of that nature. And so, if you can learn that language, if you can build a foundation in that terminology, is what I want to do, then you can apply that. And a lot of, I don't want to say that it all becomes so simple and basic and easy to understand, because that's not entirely true, but it's much more easily digestible and accessible once you get that barrier is so considerable that for many people, especially a lot of people that I've talked to, they would just, it's much easier just to find someone like me and say, what can you tell me about this? And I'm like, haven't you looked into it? And so I think that would be hugely empowering to people, whether you're at the level that I am and we are, where we're accepting and asking all these questions about virology and stuff like that, or you're maybe not quite as far down, and to kind of really show them what this science is that they're being told to accept. Instead of tell them, no, don't do this, show them this and hope that they can see why it is so problematic. But also, so maybe they will start to make better decisions, like help people to see what's in their medications, read product inserts and prescribing information, and see, and then they'll go, oh shoot, this is what this is, or to understand what are all these crazy ingredients that are in the food that's on your shelves. And maybe once you get a better understanding of that, you'll realize this is not what I want to be putting in me. So that's kind of my thinking is, make this more, the idea of science, not wet lab research, but to be able to understand it across different kinds of, whether it's a paper or, again, all these other things, and bringing that forth as a solution. And so that's what that's about. I have a website, sciencedefined.com. I'm in the process of building that website. But if you were to go there right now, you would see kind of a placeholder that says welcome to sciencedefined.com. Beneath that is a banner that has links to all of the social pages. So if people wanted to go and follow those, I'm planning to try to go live with the website and launch this pretty soon. So you'll be able to, that's probably the best way to get updates for now. And I'm really excited about that.
That's beautiful. That sounds like an incredible endeavor, and we will put the link in the show notes. So Science
Thank
to
you.
Find, sciencetofind.com, Still in the Storm, and then of course the future president of the citizen.org. We'll keep we'll keep working on that. Well, Mike Donio, you are a light in the storm, and I appreciate your work, and you continue to shine the light to everything you're doing, and we're so delighted to have brought you onto the podcast. So thank you for joining us.
Thank you so much. This was great. I really appreciate it.
All right, we're in the Pineal Room. This is the after party.
Party on, Garth.
Party on, Wayne. Party on. Hey, so we don't trust the science, but we can trust the scientist, right?
Well, especially the one that walked away from the big paycheck. I mean, that sort of seems to be the bottom line. Like when push comes to shove, what are we talking about? We're talking about having the courage to walk away from the comfy job and the comfy lifestyle and all the comfiness that the big fat check brings, and to take that leap of faith to say, this isn't right. This doesn't sit well with me. My intuition says to evacuate. And that's exactly what he's done. It's wild.
Yeah, drawing that line in the sand. Yeah, and saying, no, there is no amount of money. I will not compromise on this, and there's no amount of money that will get me to compromise.
It's crazy, and a lot of those same arguments bubble up. Like, well, certainly this whole like they all can't be in on it. Like that whole line of thinking, like, oh, these doctors and scientists, like, really, like if it was that messed up, wouldn't more people be walking away sounding the alarm? But you know, it's like a massive systemic quagmire, because it's not easy to put food on the table and to like make it through the day and the week, and just to like get through the week, you rely on your job and the security of what you do, and to go up against that behemoth, it's really not a small thing. So it's not like everyone's in on it. What everyone's in on is making a living. So it's really delicate territory to start prodding people at, for obvious reasons.
And I guess the follow-up question for Mike around how we fix science, and or his answer building a parallel structure, is for the folks who go into doing the work within that parallel structure, how are they funded? How are they getting money? We have private industry. You've got big pharma that's clearly funding a lot of the science, but we also have government agencies that are taxpayer funded that are funding some of the science or funneling that money to the private industries. So a lot of this is just coming from our pockets and our taxpayer money.
Subsidies, right?
Yeah, so when we talk about building the parallel structure, yeah, it's funny. It's also sad, and because we think we have this say in how our taxes get spent, but it's so far from the check we write or what comes out of our paycheck to where it then ends up. Like we don't really know. That budget committees throw these numbers out and put these numbers together, and how much of it goes to the military, how much of it is going to the NIH, and then what does the NIH do with that money? We just know we do what we're told, right? We're just complying. Okay, this is what gets taken out of my paycheck. Or if you're a private business, this is what I have to pay into the system, and that's it. We think our vote is going to somehow translate into the money will be funneled where we want it to, but that's just not the case.
That's I guess what I mean by it's a systemic issue.
It's a systemic issue, but there is money because it's just going to taxes. So if we could find, it's an
important reminder. It's an important reminder, and there are people who are trying to educate on ways to extricate from the system. And I guess it's easier said than done. I'm a long way from understanding how that's done, but it's certainly a worthy pursuit.
Yeah. So what I want folks to do is to extricate themselves from the system, So you stop paying your taxes to the United States of America. And what I want you to do is start funneling some of that money towards citizenscience.org. Mike Donio, future president of the board. That's not true, everyone.
Well,
For
what I
the
kept
record.
at this, just I mean, when I was going through my head when we were, I mean, obviously it does sound like fight fire with fire, like build the parallel structure, but I don't know how necessary it is to like have a formal like big organization, because I feel like so much of the work, like the research, is personal. It's like
Mm.
autonomous. It's like what works for you, trial and error. Certainly share information, share resources, share anecdotes. I mean, this whole thing, like, well, like the idea of an anecdotal success story is already has like it's smeared. Well, that's just anecdotal. But like, what are human beings but storytellers and stories? And what's an anecdote? But it's your story of what worked for you, what didn't work for you. So I feel like we need like a repository of success stories more so than another like peer reviewed system of papers. But that's maybe just me, the podcast host, as opposed to Mike Donio, the scientist, who that's the world that he knows is like peer review, actual science, back it up with proof, and like to formalize a system.
Yeah, I mean, obviously there's great value. We do the testimonials, we do the terrain transformations. These are anecdotes. These are stories. What worked for that individual to overcome what was labeled an autoimmune disease. And I think that is one way that we accrue knowledge and certainly experience and wisdom. But the scientific method is a little more rigorous, isn't it?
Yeah.
Identifying the independent variable, the dependent variable, eliminating all other variables. And it's the application of that to something like cell biology, our understanding of cell biology. I don't think anecdote gets us to an understanding of what constitutes
Right.
the cell. And in order to do that, it does require money, lab equipment, the people who are going to run those experiments. So that's what I envision. I
Yeah,
think
like if you're going to
obviously,
rewrite the textbook,
yeah.
you gotta do your due diligence. People like Bear Landau talk about, like, he's a permaculture farmer and a bioterrain advocate, but he's like, everyone should have a lab at their home. And I'm like, wow, oh, it never even occurred to me that I need a lab here. But there is obviously there's power in knowledge.
Yeah, I think of Will Padilla Brown and getting
Yeah,
started and
totally.
understanding mushrooms, and he's got microscopes. He's doing a lot of this like genetic work, and
Yeah,
he's one who seems to do great work making that feel accessible to others who want to get into mycology. Um, I mean, it certainly looked like he took to it really quickly. But I think about him as someone who started small, and then just let his curiosity take him where it took him, and then discovered the technology that he needed to work into it, created a business that supports the expansion of his research and his understanding in this field. But I look at him and I'm like, that feels like a citizen scientist. He's like
exactly.
the epitome of a citizen scientist who's doing amazing work and also able to fund himself a business, employ other people, and spread
Yeah.
this amazing message about the power of mushrooms.
That is a perfect shining example, and he should be on the board of directors for your
There it is.
crowd-funded
There it
citizenscientist.org.
is. Thank you. We're filling seats.
I kept thinking, I almost brought this up, but the conversation moved on. Because Mike Donio has literally been in the trenches, so to
Mm.
speak, like in the lab with the lab coat and the microscopes and the mice with the tumors. And I was thinking, like, these poor fucking mice, first of all, right?
Mm.
And then like the obvious question to me is like, well, how do they get the tumors in the mice, right? That'd be an interesting uh, understanding. But then I thought, like, well, who's doing the research to keep the mice tumor free? Nobody. All they want in the labs are the tumor mice. And I guess that's the case in point. It's like, how, who's doing the research that keeps the
The
most mice,
prevention. Yeah.
the
We're
prevention of
really
tumors.
good. We're
Yeah,
actually really good in the civilization at creating tumors. That's what we've
exactly.
discovered. Hey, you want a tumor in a mouse? I can get you a tumor in a mouse.
I can
I
get
can
you a
get you one
bug.
right now. I can
I
get
can
you a
get you
tumor.
100.
I can
Yeah.
get you 100 tumors in a mouse right now.
Yeah. Oh, you want it living? You want it dead? I got you. I got you covered. I got him right in my
Yeah, that's
trunk.
such a good question, Mike. We got to bring Donio back on and ask him that. How
Well,
are they? So how are they creating the tumors? All right, so they know how to create a cancer. They must be able to then
create the
apply that
tumor.
knowledge. Yeah.
Yeah, we got to create some tumors so that we can
Oh
take
my
a
god.
synthetic pharma drug to try and shrink the tumor. It's so just that premise alone should make you scratch your head and go like, what is wrong with this picture? But we don't. We take
Yeah.
this shit for granted. Well, these are
Yeah.
scientists. We defer to authority. That's the way it's been done. And then here we are again chasing our tail. It's like this chicken and an egg scenario.
And we
It was
just keep,
interesting when you got into talking about faith, and then you even brought up that line maybe after we stopped recording, this idea of leap of faith is just like a cliche expression that we use, but like the power therein, and this whole idea of like big pharma, big religion, and again that like these spiritual paths when push comes to shove, which is really what 2020 did to our culture. As push came to shove, um, it's it's about sovereignty and autonomy and like you know it's you and your connection to source. It has really nothing to do with anything bigger than you. And then of course your children and your family and your community are people like your circle of awareness and who you care for. But it's another example in that Quinian philosophy of when things get too big, bigger than the tribal model, um, corruption seeps in. Like we lose focus. It's unwieldy and ultimately unhealthy, I think.
Yeah, the more distance between you and that thing that governs you, there's just so much there's far less transparency. You can't be transparent. It's too far away. You can't see into it. It's too far away from you.
It's
Whereas
abstracted.
if it's
Yeah.
abstracted, whereas if you keep things within a community, a tribe, a small town, it's all right there in front of you. No one can hide from anything.
That's it.
Everything gets found out eventually.
Yeah.
Yeah. Big religion. I like that. Yeah. I like
And
that
what
part
else
that,
is it? That's what it is. It's
yeah.
synonymous with all these things, these big oil, big pharma, big government, big religion. It's ick.
Yeah. This feels like part of the mission, whether it's my private mission or certainly my private mission to reestablish this relationship with God or the source, whatever that is, but also for this podcast too, like allowing others, bringing others into this conversation around faith and one's personal relationship, first and foremost, that personal relationship with God or the creator or source, and the place that has in your overall well-being and health. I mean, we're already talking about the prismatic health and that mind, body, spirit. It's there. It's spirit. So what does that mean to you? What does that mean to us? You and I, Mike. And then also, what does it mean to everyone else? And also, let's talk about that. Let's not be afraid to talk about that and our relationship to that thing, whatever it is, rather than pushing it, into the shadows or not talking about it at the dinner table. This is probably the most important conversation you can have, or one of the most important conversations you can have with yourself and with others in your immediate circle. And it has been marginalized, and I don't think it should be. I think that's to our collective and individual detriment that it's been marginalized.
Yeah, here. I mean, not only has it been marginalized, it's like a lot of these, it's a stereotype, but like when, I have kids, like a teenager and a 10-year-old, and it's like when you look at what's available to them as entertainment, it's like the most base, low, what term? Chakra. It's like it's just like not high minded. It's
Mm.
literally speed and sex and violence and like literally the games these days are like how much weed can you sell. It's a video game about like selling weed and it's like it's funny. I think my kids are able to see it as like this is ridiculous, like there's like some, it's just so over the top that they're like this is a ridiculous thing that we're doing. Look, I'm selling weed in a video game and I'm 12. But it's also like it's so fucked up that that's
Mm.
been normalized, right?
Mm.
Not that there's again, I have no problem with weed, but it's just like these stigmas that get normalized for younger and younger children, such that and it just that's what becomes built in our muscle memory as we get older, is the sensibilities that speak to our lower, baser desires are what become normalized. And it doesn't even occur to you that you can have a higher minded journey, a life of the mind, a life of the heart. It's just devalued and deprioritized. And when you see it happening in real time, we sound like a couple of old guys here saying like, sex and
I'm not the
violence
one
and
saying it.
video games.
You're the one saying it. You're
But
the one saying it. You're the old guy.
it it's just so plain as day. It's just plain as day. And I guess when people start poking holes in like progressivism, that this is sort of part and parcel of that. It's like, well, it's progressive to be like sexually liberated. It's progressive to have an open mind, and these things are true. But as you've often said, it's like the pendulum swings so far. It swings so far that we lose sight of what's on the other side of the arc, and it's detrimental ultimately to what I am now perceiving as a spiritual journey.
Yeah. How well do you think this video game idea would sell? You play a character whose goal is to reach nirvana. So your character just meditates. You sit it into various lotus poses and it meditates. And that's it. That's all it does.
What do you think? Do you think Brandon Gilbert would have an opinion on how this game should be set up? What would Brandon Gilbert advise, Ben?
Based
Put
on his
yourself in,
based on his research. Um
for this video game.
Yeah, he would say you'd have to play it in a cave somewhere in the Himalayas. Otherwise it's not going to work. Otherwise it's useful. Yeah, no. I hear you. I hear you on all those fronts.
Well, because there's this whole
fronts.
conversation about like new ageism and like following into this like false light, and like that is an interesting conversation because evidently we're in a spiritual battle, right? Like, and so what nobody said, if this is indeed true, it's not going to be an easy battle, right? And so like there's not going to be any quick fix or like easy solution. Because people are very quick to say, these yoga retreats in Costa Rica where you're like, meditating and doing yoga all day, but like snorting coke and drinking margaritas at night. It's like, is that really a spiritual journey? It's easy to poke holes in this new ageism, but I still maintain, I think you do too, doing some goddamn yoga and breathing and meditating, there's a lot of good that can come from that, right? And so people are very easy to swipe down in very broad strokes what is perceived as sort of the mainstream manifestation of spirit work. But again, nuance. It's like the individual is in control, and these practices of just building mindfulness and quiet and stillness. And Mike Donio is still in the storm. That I think is lost in the conversation a little bit.
I would agree. Yeah, but yeah, folks like to tear other things down. Once something becomes mainstream enough, you get the next crop of people who want to tear that thing down, and then they prop up the new thing, which is just as bad and as riddled with nonsense and problems. But at the same time, no one introduces nuance into any conversations. They want to paint things in these broad general strokes, and that doesn't work either. So, yeah, what is the answer? It just comes down to you. What is working for you? What do you want out of this life? What matters to you? And how much of what you think matters to you is actually because you've done the internal work to figure that out? And how much of that is because you've just been listening to the voices around you that tell you what matters to you? And these are important questions to ask.
These are big questions, and that's what I'm so tickled by, is that so much clarity has arisen for me by, I guess, narrowing my focus down to what creates health. Like the what this podcast is, right? It's like a health and wellness exploration. And it's amazing when you really start to peel back the layers. And we've had some incredible mentors, right? I always reference Tom Cowan and the Baileys, these people we look up to, but like, it's amazing that we're sort of all in it together in a lot of ways, different places in the journey and different backgrounds and educations. But so much of my understanding of how the world actually works has come into focus because I've doubled down on what is real with regards to health. And again, prismatically, you can't separate any of them. And it's really validating. I remember this whole disruption or subjugation, or I don't even know what the word, like the environmental movement seems to have been like, that was my thing. I remember someone once said, like, if you're going to be an activist, like pick your thing and like dig your heels in and do that thing. And at the time I had picked, um, for lack of a better term, I think I picked climate, right? Because that's sort of where I was
Yeah.
at. Because to me at the time, it was interchangeable with being um, ecologically minded, having an ecological consciousness. I don't even like to use the word environmentalist, um, because as Daniel Quinn points out, like as soon as you declare that you're concerned with the environment, you've removed yourself from the environment. You're an onlooker. Like, well, I'm sitting in this room and out my window are some trees and some wind and some birds. That's the environment, and you immediately forget that you are it too. So I like Covell's ecological consciousness phraseology. But that, like I'm saying earlier, that was what I committed to, and it steered me wrong. Like my premise was wrong. Um, so with this new premise, what creates health, what is healthy, it encapsulates all of it. It encapsulates ecology. It encapsulates spiritual well-being. It encapsulates how I want to raise my family and the decisions I make and how my career is unfolding. And it's only breeding um, positive results so far. Is it like all, you know, yellow brick road and roses? No. Do I still like have triggers and anxieties and stresses about money and judgment and the shit people are saying about me? Sure. Like, this is real. This is just like being human and like evolving and uh and healing, and gaining confidence and all that. But it's just really special that, and I think that's what I've said in past episodes about like how important this podcast has been to me, because it's not only like something to do, something to look forward to, like an intellectual challenge, um, but it's actually informing the way that my life unfolds moving
Mm.
forward. And I don't know what could be more beautiful than that.
And I don't know what could be more beautiful than to witness it, Michael. Brother Mike.
Brother Ben.
Yeah, I see you. I witness you, and I witnessed your journey. That's what I'm saying. I mean it. I mean it. You laughing? I mean it. I mean it.
Thank
It's
you.
it is a lot of fun. Well, I appreciate you being on this journey, and to everyone out there, we appreciate you being on this journey with us. And keep sending in the notes and let us know how you're doing. If there's guests that you think we should bring on the show, shoot us an email. We're all ears. We're open to it all. Remember that nothing you heard here should be taken as medical advice, as neither Mike nor I are medical professionals. Remember that you are light, you are love, and you are your primary healthcare provider. Thanks for tuning in, and we'll catch you on the next one.